Why unilateral biportal spine surgery is important and how is it changing things for the patients?
This is a kind of eye-opener for all the patients who are planning for a spine surgery. For pain is not coming down, he is suffering from claudication, severe sciatica, unable to stand, unable to walk. You've tried physiotherapy, you've tried all medications, all failed. So then what is the option for you? So the option is a surgery. Previously, they used to fear it a lot. Why? Because open surgery, blood loss, screws.
Yeah.
These are the three contraindications in their mind.
Yeah.
Okay, I'm not going to put screws in my back. Once you take painkillers, first thing is your kidney, prolonged use, the kidney is gone. You have severe gastritis. You will have diarrhea. You will have all these weakness in the body because of the painkillers, side effect, gastritis. But some people are addicted to chronic use of painkillers. For 1 year, for 2 years, for 3 years, they have been taking painkillers, which is not advisable. If somebody is taking painkillers for more than 2 weeks, then I believe it is not at all advisable. Gradually, with all this sedentary life which is coming up with mobile phone era and all the smartphone era,
and the office work also.
yes,
Yeah.
office.
You are meant to
Desk
sit
job.
in the office for long
Time.
Yeah,
Long
and now there is a new term like it's called sitting is new smoking.
Yes, oh, it's wonderful.
Yeah.
Sitting is a new smoking.
So you got to prevent yourself from these things.
Yes. It's a very common misconception to give calcium on your medication whenever somebody comes with a back pain. Now, this can work as a double-edged sword. You give calcium, the ligaments get calcium deposits in the ligament, and ligaments get thicker and thicker day by day. And they keep on eating calcium in the faith calcium will heal my back pain or leg pain or claudication, which never happens. In fact, it increases it more.
Medicine should be used judiciously. Namaste. I am Dr. Sapkota from Nepal, Kathmandu, and I've been performing brain and spine surgery for last 10 years. Most of my work in Nepal used to be an open spine surgery where you open up the spine and you give a long incision to expose the neurological structures that cause pain in the back end, which radiates to the lower limb. It's called sciatica. So I came here all the way to Bhubaneswar with Dr. Atma, who has been a very good friend of mine. And he is one of the excellent unilateral biportal spine surgeons, which is the most advanced form of spine surgery in this world today. And all over India, most of the surgeons are picking it up. And Dr. Atma is one of the pioneers and an excellent UB surgeon. So today, I would like to ask Dr. Atma why unilateral biportal spine surgery is important and how is it changing the perspectives or changing things for the patients.
Hello, I'm Dr. Atmaranjan. I work as a neurosurgeon at Care Hospital, Bhubaneswar, India. So, Suresh, the big words you mentioned about me about the endoscopic spine surgery and thing. And you mentioned about the new ways of endoscopic spine surgery. Let's discuss why at all we need a spine surgery. And why at all, if at all you need a spine surgery, then what are the options? Because this is a kind of eye-opener for all the patients who are planning for a spine surgery. For pain is not coming down, you are suffering from claudication, severe sciatica, unable to stand, unable to walk, your foot is dropped, your foot is like this, you dropped, and you are not able to do anything because of the back pain, you are taking a lot of leaves. Then if you're opting for, you've tried physiotherapy, you've tried all medications, compressions, decompressions, everything you have tried, but all failed. So then what is the option for you? So the option is a surgery. So before that, you can try injections. Definitely, you must be trying. How is the scenario in Nepal?
Yeah, we use injections all the lot of injections. But what I feel is people with lot of stenosis or जहाँ पे बहुत ज़्यादा compression है, the nerves are impinged a lot. Injections never help for a long time.
Yes. So that is very important to understand. There is a very peculiar disease of the spine which is known as lumbar canal stenosis. What is that? We have to understand, because this is most of the doctors even don't know. If you go to some normal physician or somebody who is not that aware about the spine conditions, they will say, no, it's fine. There is nothing in your spine. It looks fine. You are okay while you are sitting. But the problem starts with the patient whenever they start standing. They stand for long hours, they walk for long hours, they cannot walk. ज्यादा तो नहीं चल सकते हैं, ज्यादा टाइम खड़ा नहीं हो सकते हैं. वही प्रॉब्लम होता है जब बैठ जाते हैं, वैनिश हो जाता है पेन. लोग सोचते हैं तो कोई प्रॉब्लम है ही नहीं, शायद मेरे पैरों में प्रॉब्लम है. Some people start scanning the knees, some people start scanning the ankles and they think there is some problem in the limb. Some people also come with varicose vein. They think
but the actual problem is on the back.
And when it is very surprisingly in canal stenosis, when you talk to a patient you are having problem in the back, they don't start understanding you. They say you are lying. Isn't it very true?
Exactly.
So, but actually the problem is in the spine, in the lower spine, and because of the claudication and canal stenosis, the patient are not able to stand for long, walk for long. So there is actually the treatment is surgery.
Exactly.
So but point is, as you said, in Nepal we have to put a big incision and decompress all those stenos spine. And we have to believe that this disease starts after the age of 50. 50 साल के बाद स्टार्ट होता है और इतना बड़ा इंसिजन, इतना बड़ा चीरा और उसके साथ स्क्रू डालना. No, you see a big screw getting inside your spine and इतना बड़ा incision, blood loss, all these, no, they seeing all these, imagining all this, the psychological safety of the patient goes away. They think there is some big surgery, major thing, I'm going to butcher my back, I'm going to put so much big screws in the back, so my life is going to be hell. So they don't actually opt for the surgery.
Yes. So this is the model of our spine. This is the tailbone and this is lumbar spine. So usually the nerve impingement occurs over here. These are the nerves that carry sensation to your legs, limbs, lower limbs. So if the nerve is impinged here, then the pain would go down into the leg,
which we call it sciatica.
Which we call it sciatica. So that's why people don't know that. Sometimes they become confused. The pain is here and the doctor is scanning my back. So it's
very confusing.
It's very
they
confusing.
They feel that doctor is lying and there is some other problem. So then definitely whenever you discuss about a spine issue and canal stenosis, the first line of therapy is always physiotherapy and medications. So we never treat without the help of physiotherapists. We can never get a healing touch. Definitely all of our patients, we give them a scope for physiotherapy, along physiotherapy and definitely some nerve soothers. We avoid painkillers. What is your opinion about painkillers nowadays for back pain?
Back pain, painkillers, sometimes we use painkillers, but a prolonged use is really detrimental. It can cause gastric irritation, and usually with medications, the pain, if the nerve compression is severe, then it rarely goes away.
So one important thing about the canal stenosis is whenever a patient comes to us for canal stenosis, they ask for medication. I said, don't take any medication. Sit at home or lie down. You won't have any pain. And surprisingly, that is true. Whenever the patient is having canal stenosis, you ask them to sit, there is no pain at all. You ask them to sleep, there is no pain at all. So why to take medication? Just sleep and sit, don't walk. That's a legitimate solution to get rid of painkillers. Because once you take painkillers, first thing is your kidney, prolonged use, the kidney is gone. You have severe gastritis, you will have diarrhea, you will have all these weakness in the body because of the painkillers, side effect, gastritis, abdominal distension, cardiac issues.
Exactly.
So it's very known because of if you get prolonged painkillers, cardiac issues are also stent. Iterocoxiv is known to put stents on the body. That's very known.
So the use of painkillers is usually restricted to acutely herniated discs. If it is like for a few weeks or 10 days to up to 2 weeks, we can use painkillers, but not more than that.
So, but some people are addicted to chronic use of painkillers. For 1 year, for 2 years, for 3 years, they have been taking painkillers, which is not advisable. If somebody is taking painkillers for more than 2 weeks, then I believe it is not at all advisable. Especially painkillers which belongs to the diclofenac group. Some of the drugs like gabapentin and all can be tried for long period, which are nerve soothers, but definitely not a painkiller.
Exactly.
As you said, even the acute pain, definitely for some days we have to give some painkillers. And second thing, I believe, what is your opinion about steroids? Most of people, how often you write steroids in a prescription?
Yeah, steroid injections, oral steroids also sometimes, but usually I try to avoid steroids only if there is acute herniation and the pain has there is a non-relenting pain on the back which usually radiates to the leg. Then I sometimes try selective nerve root blocks in these patients. Otherwise, steroids I don't prefer much.
So I believe you should all should avoid steroids because prolonged use of steroid, as we know, it's an immunosuppressant that will give a lot of your diabetes, your sugar level will rise, your hips will be gone, your knees will be gone, osteoarthritis, bones will be weak and fragile, and you are very prone to fractures, weight gain, your face will be puffy, you will start gaining weight, and people will come to us. They will say, Kiwi, I'm not eating anything, but still I'm gaining weight, which is very common.
So not advised for a prolonged use.
I don't advise. Yeah. So what I give is, I give a single shot of dexamethasone on a controlled basis. If the patient is having acute pain, I ask them to come to the hospital and get a single dose under the controlled way. So if you give them oral steroids, they will go home and keep on eating because it's very good pain relieving agent.
Exactly.
They will keep on taking it. I had a wonderful relief with that drug. Let's take it again. So they get abused of steroid, which is definitely in the long run is going to spoil your body.
So basically, we can divide these patients with back pain into two categories, right? One is a pain that is within 2-3 months.
Yes.
So acute type of this sort of pain, these patients are different category, and some patients that have pain for months or years, like 2-3 years, 4 years, sometimes decade also.
Yeah.
So in acute pain, its surgical indications are different, but I'm quite interested about this chronic pain. So what are the indications? कब आपको सर्जरी के लिए एडवाइस करना चाहिए या आप इस मॉडल पे बता सकते हैं क्या?
देखिए, मैं तो पहले सर्जरी के लिए कभी एडवाइस तो लास्ट ही करता हूँ, क्योंकि बिकॉज आई बिलीव कि सर्जरी शुड बी द लास्ट ऑप्शन एज ऑलवेज, because most of the pain, chronic pain, we have to find out the reason first. So that what is then it comes to the concept of pain generators, where the pain starts. If the person is having a pain, it must be starting from somewhere. So it may be a joint, it may be a nerve, it may be a fractured bone. So that is what we first identify as the cause. So most common cause what we have found is a mechanical back pain. Patient come, they sit like this, they do a lot of bending forward, the posture is not that good. So because of the whole back is made with muscles, so the muscle get sprained, they call back sprain or back spasm, leading to severe back pain, which may be a chronic. So your posture has to be correct first. Have a good posture, that will cure a lot of back pain, and maybe 80% will be cured with posture only. Then second is, I believe, the joints, arthritis, they have also joints. So joint arthritis is also another reason for back pain. Third thing is the sacroiliitis is most commonly missed. There is some of the conditions which is especially chronic is canal stenosis. Canal stenosis is something, your canal, and most of us we think it is because of the disc. Disc was never a cause in young it is mostly for young patient where you have a discogenic pain. Elderly, it is not a discogenic pain, and these elderlies are the group which has canal stenosis. Obviously, they cannot stand long, they cannot walk for long distance. So definitely we manage them medically first. There is a option of traction. If you give traction, the foramens open up like this. So the pain is sometimes relieved for some duration. But if it becomes progressive means you are able to walk for 1 kilometer morning walk every day morning. Now you can say after 100 meters I cannot walk. Your friends are walking but you cannot walk. You have to sit, take some rest. You say, Ki, I used to go to market every day to buy grocery and all. Now I am not able to go to the market to buy grocery. Because why? Because after some distance my leg starts to become shaky. I cannot stand for long. I have to sit. And once I sit, the pain is surprisingly vanishes out of nowhere. So those are the cases which actually benefit, and these are the cases which is known as canal stenosis benefit most from the surgery.
Okay, yeah.
Canal. So canal stenosis, if you have canal stenosis, then mostly you are going to have surgery today or after some years. Now people are living longer. I think what is the life expectancy in
No,
Nepal?
it's almost reached up to 75 years.
Yes, so it is increasing.
It's
Previously,
increasing.
if you say ki, like the now 70 is the old 50.
Yeah.
Like
Nowadays it's like almost 80 years also. People like
People
to walk, run
and
jog.
active.
So
Yes.
they are having an active life. It very old age also.
Old
So,
age, and that's very true.
Mhm.
And in those are the cases where we are going to intervene because they want to enjoy life. They want to roam around. They want to attend marriage function. They want to go to Bharati. They want to travel.
Exactly.
And they
that's
want
the
to go
point
to
of
for
life.
pilgrimage. They want to maybe all these places they roam around. I want to go to they want to be active. So those are the cases when you have canal stenosis, you cannot do.
Mhm.
So there you need surgery.
Mhm.
Previously, they used to fear it a lot. Why? Because open surgery, blood loss, screws.
Yeah.
These are the three contraindications in their mind.
Yeah.
Okay, I'm not going to put screws in my back.
Exactly.
And actually, it is not needed in a 70-year-old lady. Screws are not needed. We do open surgery, we break it, that's why we make it. If you don't break it, you don't have to make it. That is what the concept of minimally invasive spine surgery came into picture. We had MIS. MIS was again microscopic surgery where you have to put cuts. Problem with microscope was ki it is a very parallel vision. The corners you cannot see. And there is definitely bleeding. The problem is not exactly at the center of the spine, it is on the sides of the spine. So there exactly your nerves sit. So how the evolution started, people started moving to add saline to the surgery. Like other, as we say, laparoscopic abdominal surgery. There was a big fear about cholecystectomies in previous.
They used to give a long incision. Now it's down to ports.
Ports, laparoscopy. Everywhere the arthroscopy. Now corneal surgery, if you discuss, maybe when I was a child, nobody was doing corneal surgery, cataract surgery. They used to go blind, but no surgery but with recent phaco techniques and all, everybody is going for a surgery. They want to see.
It's about the minimal invasiveness that the modern world is offering.
Yes.
And because of the development of these micro cameras that can move into the inside the body through small ports, the paradigm has shifted now.
Shifted, and we call it now the eye inside the body. Yeah. The eye go inside the body to see. Yeah. Now you see it from a distance. Now you see it from a corner. There's a big difference.
Yeah.
So you see it from a very close view. So you see better, you operate better, you see the nerves better, you can operate better, and you are adding saline to it. So what it will do, it will clear the field. There will be no bleeding and nothing. And definitely this surgery is like laparoscopy. You don't have a very small incision on the back, maybe around this size incision on the back, and you operate the whole spine. There is no pain at all because you don't cut big, no pain. Exactly. Sometimes they it's like we call it like a tooth extraction. Now suppose the patient is having L4-5 compression, was operated. Now after 2 years he comes with another 3-4 compression or 1-2 compression. They say I want there is another compression, another bad tooth. I want the extraction again. Similarly, we extract the phlegm again after 2 years for the upper level if it is needed. So it can be done because the acceptance is so big. The acceptance, the awareness is changing. So if somebody is having a spine surgery and thinking of having a spine surgery, this is the newest way of doing it. We can call it laparoscopy on the back. We can call it the ultra minimal invasive spine surgery.
So with whenever I have been in your surgeries, what I believe is previously how in the open or microscopic surgery we needed to take a lot of the bone which caused instability in these patients later on.
That is why they put screws.
So yeah, that's why we often
and screw loosen after some time. You change the screws.
Now with the biportal technique, the bone work is very less. Very less, and you can go into the nooks and corners and free the nerves completely. Post-operatively, the patients are very happy.
Very happy.
Even last week we operated on an 80 years old
guy. He's very happy.
So, yeah,
and
he discharged in third day. So
the first thing is the psychological safety, which is very important. A patient you are explaining about surgery, which is big. You are showing the screws, the incision, the blood. Nobody is going to understand. Pain is fine. I don't want to go through the bigger pain, which is a surgical pain. That is very important. Surgery pain is definitely bigger. If you cut whole of the back, definitely bigger. But with this technique, you don't have to cut anything. It's a muscle splitting incision.
Yeah, muscles.
You just go there with a 4 mm, 5 mm incision, you go there, operate, and there's no pain at all. Pain. The post surgery, you don't experience any pain. You are very happy. My muscles are not it's intact. No blood loss. No elderly cannot tolerate a 1 liter blood loss. So only 10 ml blood loss is okay. Like a syringe,
Exactly.
you are removing like 10 ml blood, which is really a miraculous change in spine surgery.
Exactly. That's it.
So what do you think? How is going to change our elderly's scenario of spine surgery?
Definitely. If a 75 years old or a 80 years old patient came to my OPD, I was like helpless. The medicines don't work, and how long can you give medicines to them?
You cannot.
Especially these sort of medicines cause a lot of dizziness, and they decrease the blood pressure, and it's difficult for them to walk or even. So in elderly patients, I was quite helpless. But what I have seen is, even if a 80 years old patient, if he is walking or he has some good muscles and he is active, then we can take him up for surgery if needed. So if you decompress the canal with a very minimal bone work, then it's awesome, wonderful. So
I'm going to explain you one story about one patient. He was almost around 78 or 79 something. So the scenario came to my OPD, and he came inside, and the relatives were also along with it too. Maybe if, the daughter and the son-in-law and the wife was also there. So they came inside and said, father is insisting me for surgery. We don't want any surgery now. He's 79, you understand. And father is sitting. Father is saying, seeing your videos and everything, I want surgery now.
okay,
I asked him why, what is the issue? No, I cannot stand at all.
yeah,
I cannot stand. He said I was having these issues for 7-8 years back. But no, all explained me. I went to doctors, all explained me, we're going to put screws, and I was really scared. So, but the day come and I started to have pain while sitting also. Then it was very severe. It became very severe. I saw one of your videos, that's why I'm here. And the relatives were previously explaining, no, don't say him no. Say him no. So definitely we explained, we are doing something new. It's very new and very recent, like laparoscopy on the back. Then they understood laparoscopy, okay, I'm going to do something like the belly surgery. So then they saw the laparoscopic surgery and explained them our ways. They saw our videos. Then he got operated. And definitely now we are talking about the ligament. I just removed the ligament, nothing else, no cutting, nothing. He was very happy on day one, pain gone. And within 1 to 2 days, once the surgical site, all this inflammation is gone, he was very happy. On day one, we made him climb on the stairs because you have not cut any muscle, so strength is intact. So started climbing the stairs. So after some days, he was referred to by some politician who was working, previous politician. So they came here and they discussed about this politician also comes to my OPD for the consultation for his back pain. He was having a small disc which was, so he used to come to me. So surprisingly, I asked after a month of the surgery, how's your the relative which you have sent for surgery? He said he was recently spotted in a marriage dancing. So you understand, a 79-year-old we have operated and he's dancing in a marriage function. No, the awareness we create with the newer techniques is definitely a different level thing.
Exactly. I have a patient. I have a patient in my home only. My wife is also having some this sort of impingement problem. So as a medical doctors and family members, वो हम थोड़ा नजरअंदाज करते हैं कि
कुछ नहीं होगा.
पेन जो जब नर्व इम्पिंजमेंट का पेन होता है, it's really non-relenting and it's constantly nagging pain. So only the person who is suffering, he knows it. It's just like a thorn inside your body.
Yes.
So unless you take out the thorn, you take medicines, it's not going to work. So exactly, he must be a very happy person.
Like canal stenosis, and surprisingly, just the ligament. Now every doctor you go, I was talking to you previously, they say disc. It is not always the disc. It is a ligament.
Yeah, it's
In elderly, it is a ligament. Young patient, it may be a disc. But in elderly, it is a ligament, which is a degenerative process. If you live longer, it is a good thing and not a bad thing. Because you will have problems which is more than a degenerative set of diseases. You have heart issues, you have brain issues, you have neuropathic pain, you have claudication, you have ligaments which gets thickened over time. And now the misconception is, now I want to tell the very common misconception, to give calcium on your medication whenever somebody comes with a back pain. Now this can work as a double-edged sword. You give calcium, the ligaments get calcium deposits in the ligament, and ligaments get thicker and thicker day by day. And they keep on eating calcium in the faith calcium will heal my back pain or leg pain or claudication, which never happens. It increases, in fact, it increases it more. So definitely all of us, even the doctors, are not aware about the whole issue of the spine. The spine was neglected organ, I believe.
Medicine should be used judiciously.
Judiciously, yes.
Historically, we used to operate patients of back pain by giving a long incision, which is called open surgery. So after that, we had microscope. With microscope, the incisions got smaller, but the bone work, the amount of bone that we need to take out to reach the neural structures, it was similar. Open surgery and microscopic surgery, the bone work was pretty similar. But with the advent of this endoscope that we use with small ports, and the camera is inserted inside the neural canal, and then we remove the structures. These have totally changed the way we operate on spine surgeries. So that's why we don't cause a much of instability or difficulty for the spine. The bone work is very small, and the soft tissue that is causing impingement, or the tissues that are causing impingement of the nerve, only that are removed, preserving the neural structures as well as the bony joints. This helps patients a lot. It leads to early recovery for patients, and even we can operate even patients of 75, 80 years up to. So age is just a limit, and most of the patients get discharged in day 1 or day 2. So that's the beauty of endoscopic spine surgery, especially biportal endoscopy spine surgery, of which Dr. Das is an expert, and I came all the way from the Himalayas, Kathmandu, to learn this novel technique from this young gentleman here. So Dr. Das, will you please explain more in details about biportal endoscopy?
Actually, the endoscopy as an umbrella term we discussed, definitely we are moving from, nobody is now preferring open surgery. Definitely, we moved to microscopes. As you said, the incision got smaller. Then we moved to endoscopes. The point is, microscope has a parallel vision, and the camera stays out of the body. With the endoscopy, the camera goes closer. Once the thing goes closer, it becomes more magnified. More closer view gives you a very clear understanding of the nerve roots. Previously, you cannot see the nerve root sometimes because of the nerve roots, and there is a damage to the nerve. But endoscopically, when somebody can see better, somebody can drive better. So once you see better, you operate better. So this endoscope directly goes near the nerve, near to the nerve. So then comes to, what are the endoscopes? Well, there are different kinds of endoscopic technique. First started with distant. So one of the oldest way of endoscopic technique, but definitely it was not a saline medium surgery, it was an air medium surgery. The problem with the air medium surgery is there will be a lot of bleeding around the corners of the nerve. So sometimes the normal structures, because of the blood tinge, starts looking red, as if you are using a red filter. Everything looks red. Your phlegm looks red, your nerve looks red. So sometimes the color differentiation becomes little hazy for the doctor or operating surgeon. Then came to the saline medium endoscopy. Saline medium endoscopy is, you start irrigating the saline through whole of the spine, wherever you are operating. So what happens is, the blood is not there because of the constant flow of saline. The blood is not there. You start seeing the nerves as a nerve. The color of the nerve is retained. You see the nerve as you have seen it in the cadaver or on the human body. Exact color is taken. So that is the advantage of saline medium surgery. Then we had two options. One is a monoportal surgery, other one is a biportal surgery. Then first came monoportal, then came biportal. The monoportal was mostly designed for small discs or mostly discectomies. It's known as a target-oriented surgery. Target means you have the disc, you just remove the disc and the patient is fine. But with this elderly population, when you discuss the population has a long kind of multi-level disease, multi-level canal stenosis, the canal is severely stenosed, and you have a lot of work to do inside the spine. Then sometimes if you're operating and just two hands stuck to each other, somewhere becomes little discomfort. So this biportal is designed where your instrument is in one hand and the scope is in the other hand, and the scope becomes smaller. Smaller means you can go to the small corners of the spine, which I call as a blind spot. Sometimes endoscopy used to fail in an older generation endoscopy because you cannot go to the corners. Now with the biportal, you can, because your scope is smaller, but the camera is bigger. Once the camera is bigger, you can go to those corners very well. So you can see those structures really well, and you can do a removal, a decompression of all the four nerve roots very well, and get rid of all the phlegm, whatever is compressing on the nerve roots. And definitely, if you are operating on a bigger instruments, what happens? The surgical time is also reduced. Suppose you take a long time in the previous generation of endoscopy, in biportal, this time duration came down. So for elderly, definitely we want a 20-minute surgery. It's like a week. It's definitely a major surgery, but looks like a minor surgery. You do a surgery in a 20 minutes time or 25 minutes time. It's ultra fast surgery. You don't have to cut, you have to close, you don't have to do anything. So it becomes very easy for the anesthesia also. The surgery duration is reduced, the chances of infection, chances of having other complication, cardiac issues for lying on the floor is significantly reduced. So this is a miraculous change for elderly population especially. You have a disc also that can be removed. If you need a fracture also, that can be used. So biportal can be used in different problems. All these problems can be tackled with the biportal endoscopy, which previous generation of endoscopy was not able to tackle. So that is why biportal. Laparoscopy on the back we call.
Okay. Thank you so much for explaining beautifully. Lastly, before we go, we talked a lot about this disease, but the most important thing about this disease is its prevention. So, for the young generation, young Indians all over India, what is your message for them to prevent their back health?
Yes, so definitely we, as you said, the back is gradually with all this sedentary life which is coming up with mobile phone era and all the smartphone era,
and the office work also.
Yes, office.
You are made to sit in the office for long time. And now there is a new term it's called sitting is new smoking.
Yes, it's wonderful. Sitting is a new smoking. Yes, that's really good.
So you got to prevent yourself from these things.
Yes.
Obesity, prolonged sitting, smoking, and
this. And definitely a healthier lifestyle, good food, and good back posture is definitely a need.
Exactly.
We are not playing like when you used to play when I was a child. I have not seen my not going to play to the ground. No, our children are not also going to the ground.
They don't get enough space for playing.
So we have to do all strength training exercises so body becomes stronger. A stronger body can fight with lot of diseases.
Exactly.
And a bigger muscle mass on the back, a stronger back won't have a disease. And if you have a right posture, definitely you will not find any disc bulge because disc is also stronger, his bone is stronger, his muscle is stronger, his joints are stronger. So why are you going to have a back pain? If something is abnormal, then only you are going to have back pain. Then our thing is the food. To support your back, to make the muscle stronger, to make the bone stronger, you have to take adequate supplements of like calcium, fish, egg. If you're vegetarian, then definitely the
protein-rich
diet you have to look into. And last thing is the prevention of any addiction. Suppose you smoke, you drink a lot, maybe your bone health is going to be really bad. If you smoke, then the joint health is also going to be bad. So definitely, if you maintain a posture, good, eat fine food, do not indulge in smoking and drinking, you're going to have a better spine. Definitely. Thank you.
Thank you.